is, well, now we're going to deal with, the eyesight and low vision strategies related to glaucoma.
Excellent. Thank you. Hi, I'm Dr. Ryan Edmonds. I'm working at the low vision department over at Wills Eye Hospital, and my background there is I'm the next generation. Both of my parents work with me, and I've sort of joined up with their practice, and I'm here to talk today about what we do for glaucoma. In the beginning stages of glaucoma, we're going to be taking care of your overall visual health. So basically, we're just looking at what you're seeing. This is a careful refraction. We check for astigmatism, and we treat you with all the things that you need, like glasses, and we even do contact lenses for many of our early and even moderate stage glaucoma patients. For the most part, your vision remains very good, especially in the very early stages of glaucoma. But because of the timing of glaucoma, most people will end up needing some kind of a bifocal or a help with reading, even if you've had perfect vision up until you were diagnosed with glaucoma, and ended up in my office to try to figure out what we're going to do in the next step. For most of our moderate glaucoma patients, we're talking about, what kind of progression you're having and what kind of issues that you're struggling with. And for some of the patients that come to our office, we actually have to take a step and assess what some of the treatments that you're receiving are doing to the surface of your eyes. So in many patients with glaucoma that are taking medications, we need to be mindful if they're a contact lens wearer that they're not putting the medications onto the contact lens. That can affect the way the contact lens works, and it can affect the way the medications are dosed. So we have to be careful, and we're cautious when we approach that with our patients. We work with all kinds of different types of contact lenses. We can do bifocal contact lenses. We can do astigmatism contact lenses. And for the most part, that's where the early people in glaucoma are coming to my office, just because they need to see a little bit better. If you're using a computer throughout the course of your day, you may not realize how often you blink. It actually reduces, and we kind of work with that. We try to give you a lubrication drop that goes along with the glaucoma medication to make sure that your eyes, the surface, is all functioning properly. In the moderate patient, where we're starting to talk about more advanced parts of the surgical procedures related to glaucoma, like the trabeculotomy, the shunts, and the tubes that we had in that last feature there, it changes some of the surface of the eye, believe it or not. In a very small scale, it can actually reconfigure the very surface of your eye because of the stitches that are in place to hold the tube in, to hold the shunt in, and to hold the pieces together can actually cause a little bit of astigmatism, and we may actually change your glasses to compensate for that. We want to take a good look at the eye to make sure that it's healthy, and oftentimes while you're in our office, we'll check your pressure and give you an extra, data point to make sure that everything's going along real well. And a lot of the time with our early and moderate glaucoma patients, we're doing a little bit of extra counseling. We're telling you, right now you've only lost a tiny little bit of your vision, or you've lost just enough that, you're not even aware of it. But we encourage our patients to continue taking their medication and following the protocol and following up with their glaucoma doctors. There are occasionally times where people will come to see me after not seeing a glaucoma specialist for a number of months or even a number of years. And what I do right there is I take the opportunity to encourage you to go back into the glaucoma service to get everything checked out. If it's urgent and you haven't seen anybody in a very long time, I'll take a look. I'm okay with doing a look at that. And I've even offered some treatments to some of my patients who were unable to get in, or because of transportation or something like that. And we can monitor it for a little while in my office before I send you back on out. So that's pretty much what we do in the beginning phases of glaucoma. More advanced glaucoma becomes something of a bigger issue for us. We have to pay attention to the areas of the visual field that are missing. So in one of Dr. Pro's slides, he showed you a visual field where a significant amount of the top of the vision was missing. So we'd have to make sure that we're compensating for that in some way. And there's a couple of different options that we have. When we refract you, and the low vision refraction is a very specific type, Most of the time when you go to the doctor's office to get your eyes checked, you sit behind a large machine called a phoropter, which is that big black one, and they click the little dials inside of it, and that allows you to look straight ahead, and it tests your central vision. For the most part in glaucoma, that works pretty well, but if there's some loss and you're looking through that large machine, it's going to give you an artificial sort of feeling of the way your eyes work. So in our office, we actually take a step back and we put on a trial frame. It's a pair of glasses that looks like something from a robot with a whole bunch of little numbers on it that we utilize to add and subtract the lenses in a more real-life situation. Because ultimately you're going to be wearing a pair of glasses that's going to be sitting right here, and when you look to the side and when you look up and when you look down, you're going to move your head. Having those natural head movements available to you when we're treating the glaucoma allows you to use your remaining visual field in the most effective way possible. So when you're in that little box, you could miss the last 3 or 4 letters on the chart every time because that piece of your visual field is missing. And when we put you into the trial frame and we test each eye individually by covering one up and checking on what's going on, getting an idea or a sense of how you compensate for it and how to adapt to the changes that are happening in your vision, it really does allow us to give you a better idea of how well the glasses are going to work. And in some cases, we find very subtle little changes that just make you feel so much better. It brings the comfort of your vision back to you. And you want to be comfortable when you're looking through your glasses. We use prism. Prism is a type of lens that just moves the light up, down, left, right, or diagonal. So most glasses take it backwards and forwards and correct for astigmatism for the shape, whereas prism can actually help us to compensate for a vision that's lost. So the top half of the vision in the right eye and the top half of the vision in the left eye are missing. We will use prism to send your central gaze up and take that blind spot and move it up into the ceiling so that you're looking through the remaining good portion of your vision. Opposite effect, if the bottom is missing and you're trying to walk around, you're going to trip over things. So we can use prisms and some time to adapt to them to bring that visual field down, to make you more aware of the surroundings that are underneath you. And the same thing can happen with those prisms, and we put them together so that it works the same on both eyes. If we unbalance them, you'd see 2 of everything, and that would be very uncomfortable, and we don't want to send you out like that. The prism can also work in the way that if you're missing a lot of vision on one side of you, we can send everything over there. So when people come into my office, it's very common for them to skip with one eye all the right side letters on my chart. And if you get 3 out of the 5 letters correct, I'll let you try the next line because your vision is accomplishing that. Your threshold is there, but your attention may be missing because your visual field skips those little holes over on the side. We put a prism in place so when your head is looking straight out, your eyes are looking over that way, and you can pick up all the other letters that you need. We also use rehabilitation. In our office, we kind of figured out that most of the time adults read by recognizing the patterns of the words. And when you're a child, you learn your alphabet, and that's good. You learn a couple of 2-letter words and 3-letter words. You build up your vocabulary. But as an adult, your brain needs to receive the entire message. When you're looking over a whole entire word and you're sending it into the eye and parts of it are missing from the glaucoma, we need to really focus in, we need to dial in on what's missing and how to compensate for it. Some of the most simple strategies that we use in low vision are using your own hand to help you find the line on the page. If you're missing the left portion of your vision, if the left side is gone, you can read right across the paper, but when you go to the next line, inevitably the scanning process is disrupted because of the visual field loss. To compensate for that, the most simple thing is to use your finger and place it on the next line. Once you have that, then you're ready to go. A lot of my patients will try to read a newspaper column, and they'll read right down the first couple of lines, and then by the 3rd or the 4th line, they'll skip the first word. There will be a gap. And if you skip one word on a line of newspaper column, you'll probably still be able to figure out what's going on. But on the next line, it happens to be that you skip the first 2 words. And then the next line you skip 2 words, and then the next line you skip 3 words. And pretty soon that newspaper article that you were trying to read becomes frustrating. You can't find the beginning, or in some cases you can't find the end. And when your brain wants to comprehend something when we read as adults, your visual processes need that full and complete information. When the holes come through because it's not being transmitted, your brain will fill in the blanks. It will create words that aren't there because it seems like it sounds like it go along with it, but then very quickly that sentence structure is going to disappear. And your ability to figure out what the message from that newspaper is begins to deteriorate quickly. So that is when we start to use customized strategies to try to enhance the way you're using your eyes. In severe and end-stage disease, this is the point where the doctors have done everything they can on a surgical or medical basis. They've put all the drops in your eyes, they've given you all of the pieces of the puzzle, and I get to take you from there and figure out, well, what's left, and with what's left, what can we do with it? And in many cases, even in fairly severe stages of glaucoma, your central vision can still be preserved to some extent. So we can have a patient who has, 20/25 vision or 20/30 vision who has significantly advanced glaucoma. And I can put all the lenses in front of you and everything looks great and you can read the letters on the chart. But if the letters become larger on the chart, the ones that are this big in the beginning of the chart, if we start there, a lot of those patients miss that because they're only seeing a piece of that individual letter at any given time. So in order to compensate for that, we need to use what's left of your good acute vision and maximize it to the best of the ability. For the most part, reading exercises are useful for these patients because it teaches your eyes to scan using your remaining vision. By doing repetitive close work, it actually allows your eye to just jump around and find exactly what it needs to do. One of the big things that we focus on is your activities of daily living. I've been walking my way through the whole concept of glaucoma. Each step is taking more and more of your vision until eventually when I'm looking into the back of that room, instead of seeing both doors, I'm only seeing one of the doors and the clock. And the other door can open and close and I won't know that anybody's come in or out of the room. That's a very frustrating thing in glaucoma, especially in the severe and the end-stage patients, because they may recognize your face, but finding your face is going to be very challenging because there's no information coming from over there. This appears to make people jump out at them, and it can surprise them. So one of the things that we do for some of our glaucoma patients is we want to help you to identify yourself to your friends, family, and to strangers, really, to make sure that you are maintaining safety in your own home and in your own daily life. Many of you have heard of the white cane or seen somebody use a white cane. And for those of you who have seen somebody using a white cane, for the most part, chances are you either maybe helped them across the street or told them when the light was green, or if you weren't going the same direction as them, you took a step to the side and allowed that person the room. Well, if you have glaucoma and it's becoming advanced, you become a hazard to yourself a little bit. You want to not trip over things, so using the white cane can give you another sense of your surroundings. This is one of the things that in my department we end up recommending to patients who are on their way out, that need a little bit of extra help, and they may not have a caretaker or a family member available at all times to work with them. So utilizing a cane isn't the worst thing in the world. I do have a couple of patients who start using it while they have vision. Some of them even while they have some very good central vision. But if the whole bottom of the vision is missing, and I send the last little pieces down to the ground, well, then you can't see anything in front of you when I use those prisms. So I have to be careful. There are some limits to what we have to work with, and we just have to be mindful of that. One of the biggest benefits that I actually heard from somebody who utilizes a white cane was their identification to other people. The people who jump out at them, the people who bump into them. You know, people aren't always exactly the most friendly when you're walking down a crowded street at rush hour to get to work. So if you can't see somebody to your left and you bump into them, you can cause, a little bit of tension. And if you happen to have that white cane and somebody bumps into you, they're more likely to apologize or even help you out. I had one of my patients who was using their white cane. Somebody ran into them and fell over. And she was standing there saying, I'm terribly sorry. I did not know you were coming. I truly didn't. And, the gentleman was okay. He was all right. But, she kind of said, this is, I'm doing everything that I can to let you know that I'm here. And, for some of it, it's our responsibility, too. For the most part, people who utilize those canes can become very independent in their function, particularly if they have that last little bit of vision left. So when we talk about all the ways we try to help our patients, we want to make sure that your home is safe. People who have vision loss may need a couple of different things in their home so that they can understand what's going on in their kitchen, if the stove is on, if the stove is off. And we can use all kinds of different things to work with you. And we would refer you out to our occupational therapy people who would come to your home and give you an assessment of what kind of safety we're working with. For the most part, the tools that are useful in glaucoma are different depending on the stage. Again, in the early or moderate glaucoma, I'm just going to make sure that your glasses are looking great. And if you need a little boost with your reading, if you need a little boost to help you see a little better far away or at night, that's something that I'm going to be able to try to work with you and work through it. In the more advanced glaucoma, we're talking about doing the things that make you more comfortable with your vision. You have enough vision to be able to read, you have enough vision to be able to see and to function independently with advanced glaucoma, and we're just compensating for the very specific pieces that might be missing in your visual world. And then for our severe and our end-stage patients, we can do the rehabilitation, and we can send you out for the other services, talking books and the cane and the potential for a companion dog and those kinds of sources